Post-traumatic stress disorder, PTSD, is a mental health condition that can develop in individuals who have experienced or witnessed a traumatic event. It was first recognized as a formal diagnosis in the 1980s, primarily associated with military veterans who had experienced the horrors of war. However, PTSD can affect anyone who has been through or witnessed a traumatic incident, such as violence, natural disasters, accidents, or other life-threatening events. Key features and characteristics of PTSD include:
exposure to trauma. PTSD is triggered by exposure to a traumatic event, which involves actual or threatened death, serious injury, or sexual violence. Traumatic events can vary widely and are highly subjective to the individual experiencing them. Intrusive symptoms. Re-experiencing individuals with PTSD often experience intrusive thoughts, memories, nightmares, or flashbacks related to the traumatic event. These re-experiencing symptoms can be distressing and vivid, making the person feel as if they are reliving the trauma.
Avoidance. People with PTSD may actively avoid reminders of the traumatic event, such as places, people, or activities that trigger distressing memories. Avoidance can also extend to avoiding discussing the event or blocking out emotions associated with it. Negative cognitions and mood. PTSD can lead to negative changes in thought patterns and emotions. Individuals may experience negative beliefs about themselves or the world, feelings of detachment from others, or a persistent sense of fear, guilt, or shame. Hyperarousal. Individuals with PTSD often experience increased arousal, including difficulty sleeping, irritability, hypervigilance, being constantly on guard, and exaggerated startle response.
Duration of symptoms. For PTSD to be diagnosed, the symptoms must persist for more than 1 month. However, some individuals may not develop symptoms until weeks, months, or even years after the traumatic event. Impact on daily life. PTSD can significantly impair a person's ability to function in their daily life, affecting work, relationships, and overall well-being. It's essential to recognize that not everyone who experiences a traumatic event will develop PTSD. Individual factors, such as pre-existing mental health conditions, past trauma history, and available support systems, can influence the likelihood of developing the disorder.
Treatment for PTSD typically involves psychotherapy and, in some cases, medication. Cognitive behavioral therapy, CBT, specifically trauma-focused CBT, is one of the most effective therapeutic approaches for PTSD. This form of therapy helps individuals process traumatic memories, challenge negative thought patterns, and develop coping strategies to manage distressing emotions and symptoms. Eye movement desensitization and reprocessing, EMDR, is another effective therapy for PTSD, which uses guided eye movements to help process traumatic memories and reduce distress.
Medications, such as selective serotonin reuptake inhibitors, SSRIs, may be prescribed by a healthcare provider to help manage specific symptoms of PTSD, such as anxiety or depression. If you or someone you know is experiencing symptoms of PTSD after a traumatic event, seeking help from a mental health professional is crucial. Early intervention and appropriate treatment can lead to effective management of PTSD symptoms and an improved quality of life. How does it start in childhood?
PTSD can develop in childhood after a child experiences or witnesses a traumatic event. Children are vulnerable to the impact of trauma due to their developmental stage and limited coping mechanisms. Traumatic events that can lead to PTSD in children include physical or sexual abuse, accidents, natural disasters, witnessing violence, or experiencing the loss of a loved one. Here are some key aspects of how PTSD can start in childhood. Direct traumatic experience. A child may develop PTSD after directly experiencing a traumatic event. For example, a car accident, physical assault, or abuse can have a significant impact on a child's emotional well-being and may lead to PTSD symptoms.
Indirect exposure. Some children may experience trauma indirectly, such as hearing about a traumatic event happening to a family member or close friend. Indirect exposure can still have a profound impact on a child's emotional state. Developmental impact. Children's cognitive and emotional development can influence how they respond to traumatic events. Younger children may have difficulty understanding and processing the trauma, leading to confusion and distress.
Recovery environment. The availability of a safe and supportive environment can significantly influence a child's recovery from trauma. Factors such as the presence of caring and supportive caregivers can mitigate the impact of trauma and reduce the risk of developing PTSD. Pre-existing factors. Pre-existing factors, such as a history of previous trauma, family history of mental health issues, or exposure to chronic stress, can increase a child's vulnerability to developing PTSD after a traumatic event.
Did you find this video informative? If you have any tips about your journey with post-traumatic stress disorder, PTSD, share with us and leave them in the comments below. Thank you for watching the video, subscribe to the channel, and give it a thumbs up. Goodbye.